what they were noticing with MDMA in particular was that it has this ability to induce effects where you feel your heart expand. You feel more bonded towards others around you. You have more access to memories or emotions. There's this widening of the aperture of your own emotional availability. And so if you think about that in the context of therapy, it's potentially very interesting effects that could unfold there.
Hey everyone, today I spoke with Dr. Allison A Feduccia about psychedelics, namely MDMA. Depending on if you consider MDMA a traditional or classical psychedelic or not, you put it in that box or you don't. But nevertheless, we discuss MDMA, also psilocybin and ketamine, and how these tools can positively impact one's brain, one's limbic system, and lead to impacts on PTSD, substance abuse, marital or relational challenges. And what is impressive about Allison is the research that she's performing and publishing. Obviously, this is a growing, burgeoning area of interest, and I think rightfully so. So stick around, check out the episode. We'll be talking about how these compounds, again, can improve brain health, improve happiness, help with recovering from trauma, and the like. Hey everyone, this is Dr. Ruscio. I am here with Dr. Allison Feduccia, and we have a exciting psychedelic topic to unpack today. Allison, welcome to the show. I'm really so excited to pick your brain.
Well, I'm happy to be here. Thanks for inviting me.
You know, when we started looking into guests to discuss psychedelics, as you can probably imagine, there's a lot of self-proclaimed experts out there. And then if you look into sort of their CV and their background, probably trying to help people, no argument, but it's a lot of, I'm a executive sort of lifestyle coach, and I use psychedelics in sort of an off-label way in a big city. In Austin, there's a few pockets of this, which is all fine and good. But my preference is to find someone who is working in academics, at least to some extent. And when we came across your work and some of the papers that you published, I was really excited to better learn what you're finding. It seems that mainly it's PTSD that you're studying, but maybe we start with just sort of a really high level on who you are and how you got into your interests with psychedelics, and then we can define what psychedelic you've been studying in particular, and then go into some of the health benefits. But I'm curious how you sort of on-ramped into this area of study.
Sure. When I was doing a graduate program at the University of Texas, we were studying different compounds. One of them was MDMA, and we were trying to understand how this worked in the brain to induce different effects. And at the time, there was very little research being done in humans. And the year that I started graduate school, 2004, was actually the first time that MDMA was being investigated when combined with psychotherapy for treating post-traumatic stress disorder. And at the time, I wasn't involved in that work, but as we started to understand how MDMA could make people feel, and that it was actually used in the late 1970s and early 80s as an adjunct to psychotherapy, particularly with couples. And at this time, there had been no clinical research studies done. It was not a Schedule I compound. It's also known as ecstasy. And so at that point in the mid 80s, it became an illegal banned substance, which essentially shut down clinical research to understand any type of therapeutic benefits it might have. So I got very interested in what this compound was, and that there seemed to be this resurgence of interest in looking at it for use for treating mental health conditions.
And this compound, MDMA, aka ecstasy, there's a few AKAs, and maybe we can sort of unpack. This isn't necessarily a party drug that someone makes in their basement, although I guess some people can make it in their basement. But it did emanate from pharmaceutical research, and as I understand it, it was being studied, I believe, for blood pressure. I may have that wrong, and kind of put on the shelf for a while. And then years and years later, a researcher, and blank on his name, I want to say it's Stanislav Grof, I may be totally butchering that, and his wife, who was a psychotherapist, sort of rediscovered it and had all this applicability to psychotherapy. But maybe you can give us the short backstory on how this went from a shelved pharmaceutical to, I don't want to say mainstay, but mainstay in certain pockets of sort of couples therapy. And I believe this was in Northern California.
Right, right. So in 1912, it was synthesized by Merck Pharmaceuticals, and it was patented at the time. However, it was never actually tested beyond some very basic animal models. And it is true they were looking at it for something related to blood vessel dilation. No one knew that it had the psychoactive properties that it had until Alexander Sasha Shulgin resynthesized it.
Sasha Shulgin, thank you.
Yeah,
not to cut you up, but Stanislav, is that a different psychedelic researcher? I'm trying to get all the names in the field here in my mind as I'm acclimating. Where does he?
Sure. So Sasha Shulgin was a chemist that synthesized lots of different compounds. You can read about that in PCAL and TCAL, books that he and his wife, who was a therapist, and Shulgin wrote together. And then Stanislav Grof is a well-known researcher who was working on LSD in the first wave of studies that were going on in the 1940s and 50s. And he went on to write many books and talk about non-ordinary states of consciousness and his experiences with working with over 5,000 people before LSD became also banned and research was halted in the 60s. Right.
And so the experimentation started, and they were noticing potential applicability with couples. At this time, it wasn't illegal, so kind of gained wide popularity. Was there any research being done at that point in time, or was it all anecdote? This, I believe, is in the 70s.
Yeah, so the late 70s, the Shulgins here in Central California were, they were synthesizing various compounds and testing them on themselves and others, which is pretty wild to think about. But what they were noticing with MDMA in particular was that it has this ability to induce effects where you feel your heart expand. You feel more bonded towards others around you. You have more access to memories or emotions. There's this widening of the aperture of your own emotional availability. And so if you think about that in the context of therapy, it's potentially very interesting effects that could unfold there. But you're right. What happened is that people also found that this was a very nice experience to have at a nightclub. And Sasha Shulgin actually called it I forget exactly what it was, but instead of a martini, it was his, it's like drinking a martini or two to take something like MDMA to just sort of relax the mind, relax the senses, connect more fully with others. So that's why it got to be quite popular in the club scene, and later on got very associated with raves or all-night dance culture. And I think it's also really important to differentiate between ecstasy, which is known to have often many different substances combined, whereas in these clinical research settings or therapeutic practice, if it gets there, it'll be the pure form of MDMA. And we like to talk about the different risk factors from taking a psychedelic substance in a controlled clinical setting with good preparation and support versus if you're going to be taking something like this outside of an environment like that. Right.
And one of the compounds that sneaked its way into ecstasy as compared to MDMA is fentanyl. And, this is where you hear the occasional horror story of someone having maybe even a fatal episode from fentanyl. And as I understand it, people can use at-home testing strips. And I think the government in some places has even made these testing strips really easily available so that people who might be purchasing this compound on the black market at least have a way to assure there's no fentanyl in there. But Any thoughts on fentanyl? And not that we're advocating people do this on the black market, but knowing that some people may be, just trying to give them safety precautions to adhere to. What are your thoughts?
Yeah, it's really devastating, the widespread contamination of many different substances out there, including pills that look like something like Adderall, or a pain pill can contain fentanyl. And there are drug testing kits and fentanyl strips that you can buy. We offer a free harm reduction course on our site, Psychedelic Support. And it is true, if people are going to engage in this, to have the right tools and information to know how to stay safe.
Right, right. Let's go to some of the benefits. I want to kind of go through the long, short benefits, risks, who should not use this. You said heart opening, and boy, especially post-COVID, I would think this would be a great time for people to be better at connecting with one another. I mean, in the setting of couples therapy, I think if anyone has had a relationship that was on the rocks, that can be one of the most emotionally draining things, is just cohabitation with someone with which there's this constant tension. And this is where I see the applicability of MDMA. So maybe we start there in terms of the benefits, in terms of what you're seeing clinically, and what are the upsides associated with this compound.
Sure. So most of the protocols that are being investigated include preparation sessions where someone is not on a substance. And that's a way for the therapist to get to know the person engaging with therapy, and prepare them for the MDMA experience, which can last for 6 to 8 hours. So it's a real deep dive into whatever the intention is. Often there is, if we would use the example of couples therapy, perhaps some relational issues to discuss. And the effects of the substance, it releases serotonin, norepinephrine, and dopamine. It also releases neurohormones, including oxytocin, vasopressin, prolactin. And the oxytocin component is really interesting because that is the hormone associated with bonding. So this is released when a mother has a baby. This can be released also between humans and pets. So this makes you feel closer to someone. And what happens during the psychotherapy, it can be any number of things that unfold depending on the individual. But a lot of times people are able to kind of push away the things that get in the way of you feeling that essence of love, of that pureness of, if you didn't have any problems and you could experience complete joy and love and appreciation for someone, even yourself. So that self-compassion, compassion for others, it's a really huge factor in allowing people to then look at their problems or their issues in a different light, and perhaps say things to themselves or others that they didn't have access to otherwise. And often they describe this therapy as, within 8 hours, it was more like doing 10 years of psychotherapy, because they're really able to drive right into the areas that are the most prickly. And often our defense mechanisms don't want to take us there. So in that way, the drug really facilitates the therapy. And I believe it's not so much just the substance itself, but it's this combination of the substance with the psychotherapy that helps people so much.
I wondered how much of two different potential items are present. One could be, I guess, neuroplastic changes. There's this theory that if there's enough stimulation of certain pathways, that maybe the pathways your brain is normally firing can't handle all of that stimulation. So other pathways form, and you sort of, like that analogy of the first sled down the snowy hill, you can have other sleds and other pathways form, rather than one pathway that might be sort of this rut of feeling begrudged with your spouse or with your partner. So I guess one is more neurochemical, plasticity based. The other I wonder about is how much of this is coming to a realization that you weren't able to come to before. And now that your state's been altered a little bit, you can look at an issue in a different light. Probably both of these, and maybe other mechanisms also occurring. But how do you look at both of these and their interplay in terms of where the results and the healing come from?
Sure. So there's probably many different mechanisms of how psychedelics work, but there has been studies done in non-human models showing that a common underlying factor across many of these different psychedelics that work in different ways in the brain and the body can induce neuroplasticity. And that's the basis of learning new things. So that's a really interesting phenomenon happening of why someone might be able to make big changes after doing psychedelics. Most of the work that I've been involved with was with post-traumatic stress disorder and using MDMA-assisted psychotherapy. So we've published a paper looking at the possibility of memory reconsolidation. So when someone undergoes MDMA, we see a decrease in the amygdala, which is an important brain region for emotion, but particularly the fear response. We also see greater connectivity between the amygdala and the hippocampus, which is the seat of where memories form. So to us, that really speaks to the idea that if someone is undergoing MDMA-assisted therapy for post-traumatic stress disorder and bringing up these old memories that were traumatic, a lot of times with PTSD, people can't really feel the emotions associated with the memory. Can be hypovigilance or hypervigilance. So maybe there's this optimal state where the memories can be processed in a different way and then filed back in the brain in such that they're no longer triggering the symptoms of post-traumatic stress disorder. So that's one kind of specific example of how during psychotherapy, MDMA and the neurochemical release that's happening might facilitate this memory reprocessing, or fear extinction is another model that's been demonstrated in non-human animals with MDMA. If we were to go back to the couples.
Quick question on the limbic system and alteration of activation of different components of the limbic system. Is this while on the substance? Are there any data showing that maybe a day or a week later there's sort of a prolonged impact on the activation of the amygdala?
Sure. So more of that has been done with psilocybin, which is the psychedelic compound that's in magic mushrooms, or people might be familiar with that. There's been neuroimaging studies showing with this compound that our default mode network, which is often activated in normal states when we're just sort of daydreaming or our normal process is happening, that it can actually shake up the system and allow for different areas of the brain to connect and communicate. And what's fascinating is that they showed after psychedelics, so that might be helpful in maybe shifting depressive thoughts or rumination or thought loops that aren't helpful, but that a couple weeks after taking psilocybin, that network actually comes back on stronger. And not that your brain is all of a sudden just frazzled and you're not thinking clearly, but that it comes back stronger. However, people feel this alleviation of depressive symptoms, and they have new insights or motivation to work with to really apply that to their life. And I believe it's not really just the substance happening. I think sometimes these experiences can be easily forgotten, but likely there is this window, maybe it's neuroplasticity that's unfolding, where people can really make some big changes in their life, or think about what's holding them back in a different way.
Right. And I guess another way that we can at least inferentially answer that question is, if we see prolonged therapeutic effects, we can assume something is being impacted positively in a long-term fashion. And that's probably where you have some insights. I'm assuming with your couples therapy, you're doing periodic reevaluations over time. So what are you seeing regarding, the post-therapeutic or the post-interventional therapeutic effects?
Sure. And just to clarify too, so far there's only been one small couple study done with MDMA in modern time. And actually all time, because before it was just unsanctioned sort of underground couples work going on. But and
I guess we can look at PTSD and see what the prolonged effects there are also, and just get a sense for are the impacts in the brain prolonged to some extent. And I know in other models with, with MDMA, there's some pretty compelling data for PTSD. In fact, that was the first psychedelic that came across my radar. Credit to Jordan Peterson. This is going back maybe 3 years ago, talking about the fairly high success rate with recalcitrant PTSD when using MDMA. So there's got to be something happening positively long term. I guess we're just not sure exactly how do we map that out in the brain, because we can't exactly just go into people's brains and start biopsying, and functional MRI studies are probably not the easiest ones to get approval for due to the cost of doing those in like a serial fashion.
Yeah, there are more neuroimaging studies on the way, but MDMA for PTSD is furthest along with the FDA approval process. So MAPS, Multidisciplinary Association for Psychedelic Studies, has been spearheading this work since 1985 when it was banned, and have now completed 2 phase 3 studies and looking to ask the FDA to approve this as a medicine in 2024. And what we saw in these studies was after the treatment protocol, which included the preparation, 2 to 3 MDMA sessions, and then what we call integrative sessions after each MDMA session. So there's 3 of those 90-minute sessions where the person gets to talk more with their therapist about what came up during MDMA. So it's a lot more than just the drug, again, that's working on the person. And there is a really large success rate, something around 67% of participants no longer meet PTSD criteria after completing it's about 40 hours of therapy altogether. And at the long-term follow-up, which was around a year after treatment ended, many of those participants still had a reduction in PTSD symptoms, and a lot of them had even improved further. And so what seems to be going on, and what a lot of the participants reported, was that after they were able to sort of deal with the trauma, like really process what happened, and maybe this is related to the memory reconsolidation, that they're able to make changes in their life that improve the quality, whether that was they were able to get a job or function better in their relationships, perhaps they were able to make some behavioral changes, like have the motivation and to be able to exercise or go to social situations where otherwise they were really inhibited to do things like that, which is kind of a negative spiral
Right.
when you're coping with PTSD in that way.
And I believe there's at least one trial that tried to control for drug intervention with psychotherapy and then without psychotherapy. Are you familiar with this study? Because that's one of the questions I asked myself. Well, maybe this is purely just drug-induced effect, and the therapy is nice, but it's not necessary. And so when I came across that study, it was helpful to establish that the combination of psychotherapy and the drug are really what gets you the optimal effect.
Sure. So that's most of the study designs that have been done with MDMA-assisted psychotherapy. The placebo control group is just psychotherapy. And so what these studies have shown was that, yes, there is an effect of psychotherapy, and that can be helpful for people. And that's important to remember. There were people that saw a significant drop in their PTSD symptoms from psychotherapy alone. But when you add the MDMA, it's about 3 times the effect. And often people say it's a much quicker process than, say, many years of therapy. And these studies were enrolling participants that have chronic and severe PTSD, because this early research, the FDA really wanted to make, in testing the safety of the substance, people that really had no other options, had failed on other treatments like SSRIs or EMDR or talk therapy, things like that. So people just at the end of their ropes of needing help, they tried everything, and, could this experimental treatment help them?
And is there a certain protocol that seems to be the best? I believe MAPS was waiting 3 months in between administration, or just otherwise generally curious. Do you think one session with MDMA plus a psychotherapy, I guess pre and post, is sufficient? Is it better to have maybe a a second round of the MDMA, which I believe, again, MAPS is waiting about 3 months in between. Curious if there's any sort of frequency or number of sessions that seems to be the best.
Sure. So MAPS studies were actually looking at either 2 to 3 sessions, and they were spaced 3 weeks to a month apart, typically.
Okay.
It really depended on the individuals. Like sometimes a person would have a really huge breakthrough after one session. Other times people would do 3 sessions and still feel like this brought up a lot. I'm really unpacking years and years of baggage here, and I could really use more sessions to complete this work.
Sorry, let's unpack that a little bit, because I'm also curious, how does one define a breakthrough versus maybe realizing some stuff needs to be more thoroughly addressed? Because I could see the compound is so novel that everyone's like, oh, it's a breakthrough because it was so different and novel and I felt so happy. Is there a way to distinguish one from the other?
What comes to mind is it was a veteran participant who was also struggling from alcohol and substance use. And after going through one MDMA session, he had this insight to whatever had happened during his time in combat, that he found forgiveness there, some acceptance there, and that he never wanted to touch another substance because he was so grateful to have the opportunity to be alive when he had known so many people that had passed away in combat, and that he didn't want to take any more substances because he felt like, as Alan Watts says, if you get the message, hang up the phone. And that really rang clear to him. He had what he needed to get his life back on track. And then, other people, it's a longer process. And I think if this does become a medication, it makes it to clinical practice, like as an FDA approved substance, it'll really be up to the therapist and the person to map that out. And I think it'll be a really individualized approach with some guiding best practices. There is that risk of pharmaceutical companies developing drugs that it's more profitable to have somebody come back as much as possible. So that's something to consider. I think a longer integration period, what they call it, can be very beneficial for many. With the clinical studies, it's you have to follow these protocols very carefully, and there's not room for the extra sessions, perhaps in an extra integrative session, but not an extra MDMA session, and that type of thing. So we'll learn a lot more with the flexibility of the models as they become available.
And regarding availability, it was I believe it was decriminalized in Australia. Am I correct there in my understanding?
They have actually passed some legislation there where doctors can now legally prescribe MDMA and psilocybin. I don't believe it can be taken home. It's still in this model of supervised or combined with psychotherapy. So they kind of skipped over the whole clinical development process. And we'll see how that unfolds.
Right. What about dosage? I believe this is dosed 1.2 to 2. The units are escaping me at the moment, but how would people go about dosing this? Because my understanding is more is definitely not better here. And this seems to be a trend with many of the psychedelics where there's kind of a Goldilocks. And I just make that remark because, myself included, sometimes it's easy to think a little bit good, more, better. But in this case, where should people not, again, that we're advocating doing it on their own, but what is sort of the optimal dose?
Sure. So in MAPS studies, the active dose range was between 75 milligrams and 125 milligrams. And then there was always this optional supplemental dose. So after 2 hours of the first dose, when you're in the session, the person would be offered half of whatever the first dose was. And that would help to deepen the experience or prolong the effects. I think it is important to differentiate between MDMA and other substances like classical psychedelics, including psilocybin, DMT, LSD. MDMA has a different safety and risk profile because it's acting to bind to the serotonin reuptake transporter protein, which is normally taking serotonin back into your neurons, does a tricky little thing where it reverses that and allows for a flood of these neurochemicals to come out into the synapse, where they go on to do other things in the brain. Because of this, you can reach a point where you can have serotonin syndrome, you can have greater neurotoxicity, which was shown in animal models at really high doses of MDMA. So in the clinical work, that's not a risk factor within the doses being tested in these clinical programs. However, if people are taking this out on their own, there's such thing as called stacking MDMA, taking multiple doses. The pharmacology is such that it's not linear. So as you start taking more, you're actually not able to metabolize it as quickly, and you're going to get a lot more of that drug in your brain and potentially have some side effects that are uncomfortable, or all the way up to some pretty serious side effects.
And one of these, I believe, is a increased rate of your heartbeat, and also you get really hot. And as I understand it, that can be problematic, especially when used in sort of the club or rave scene, because it's already presumably going to be hot inside one of these places. You're going to be moving a lot if you're dancing, and this is where people can overheat, and then brain damage can ensue secondary to that sort of hyperthermia.
That's right. Yeah, and dehydration could be an issue there with people that are exerting a lot of energy. Also, individuals that have heart disease, cardiovascular disease, MDMA could be pretty risky to take. Generally, in the studies, participants had to be able to tolerate, say, moderate exercise. It's going to elevate your blood pressure and heart rate to about a pretty moderate cardio. So if you're already compromised, that too could cause some issues.
Yeah. Are there other risk factors? I know for at least psilocybin, schizophrenia is one to be aware of. You gave the cardiovascular, but what other contraindications exist for MDMA?
Yeah, so with MDMA, there are some medications that you would not want to combine with MDMA, including MAO inhibitors. Generally, any drugs that are working on the serotonin system, you want to be careful with. With psilocybin, another classical psychedelics, it is true. It's been there's not much research on this, but anecdotally, it's known that sometimes classical psychedelics like psilocybin, if you have schizophrenia, bipolar disorder, personality disorders, that it can exacerbate the symptoms and make it worse. There are some new studies being started up. One is at UCSF that is going to be looking at borderline personality disorder and some of the other more complex psychiatric conditions, and seeing if psilocybin, can be given safely in this clinical environment, and would it help these conditions as well.
In your experience clinically with the appropriate screening, is there a fairly low adverse event percentage or incidents that you're seeing?
Yeah, so the clinical research studies, when they're conducted in these controlled environments with well-trained practitioners, the incidence of adverse events are quite low and transient, meaning that for MDMA, we'll see elevated blood pressure, heart rate. Sometimes people experience nausea or vomiting. Most of these are transient. There can be anxiety or even some feelings of panic, particularly on something like psilocybin. But when you're there with the support, it's usually easily worked through. And the idea is that it can be challenging, but that those challenging experiences also have meaning and value to dig into. And it's also interesting to think about what's happening in the brain during that. Is it this reprocessing? Is it releasing some energy or attachment to hard things that people have faced?
Sure. And you've been doing this for a little while. Are there a few interesting case studies that you can share with us in terms of people? I mean, you mentioned the veteran, great case study. Any similar cases that you'd want to share?
Let me think about that. There's a great book that just came out by Rachel Newer called I Feel the Love. And it's about MDMA. And in this book, she interviews Lori Tipton, who's been quite vocal. She's gone on many podcasts and videos. She's lives in New Orleans and just faced some very, very traumatic things, including, a brother overdosing in front of her, finding her mother murdered. Just so many traumatic things that happened to her as growing up and a young person, and how much that had closed down her life. And through MDMA-assisted therapy, it just opened. She was able to, I guess, just come to some conclusion around that, where before she never had. Like, she just carried the weight of that, like a heavy bag of stones for so many years, and it interfered with her relationships with her partner and her children. And after unloading all that baggage, she felt like a new person, and it felt important to her to go and share her story and help others realize that healing can happen no matter how difficult your life has been and how many shit cards you got dealt. So she's a really inspiring person and speaker that you could read more about her story online.
And I feel it to be an important concept just to sort of reverberate, because in the clinic, sometimes we'll see people who say, well, I've been dealing with this for 5 years, 10 years, 15 years. Does this mean it's going to be harder to resolve because of that? And I don't think there's any one answer to that question, but my general perspective is it doesn't really matter how long you've been dealing with the problem. That just could mean that you haven't had the right solution for a longer period of time. And as soon as you do, you're going to have this off-ramp to a higher level of health. And this has partially been borne out, just to use one data point, in individuals who are on thyroid hormone that didn't need it. The researchers did not find the longer you are on hormone, the harder to come off. There was no correlation between length of time on hormone and ability to successfully stop and have normal thyroid function. So it's just one somewhat tangential data point. But just to share with people, length of time or chronicity does not mean severity. They're not directly equated necessarily.
Yeah, I definitely believe change is possible for anyone. And we didn't really touch on this, but psychedelics have a way of the spiritual aspects, and how people that take these journeys often report questioning more about, why are we here? Who am I? And reconnecting to some truth around ultimate safety and being in this life, and whatever that means to them. And it's not about being religious. It's about this sort of trusting and knowing in a higher purpose or a higher self, or and that could be hugely transformative for people in a very short period of time. And being a neuropharmacologist and a scientist, it's hard to sort of meld these worlds together, but it's definitely a piece that can't be forgotten with why psychedelics might be so profoundly inspiring to people.
It's a great point, and I'm so glad that you raised it. And I struggle with that same thing. On the one hand, being a scientist and wanting to document things in RCTs, and then on the other hand, having experiences using similar compounds or during meditation where there's just something else there that's hard to quantify. We can partially quantify, and there's data showing that people who meditate 20 minutes per day have a longer life expectancy and things like this. But I think what you're getting at is that existential either meaning or ability to find a purpose or a reason for the path that gives them, I don't want to say validation, but it just changes the perspective a little bit. And that can be admittedly probably very hard to scientifically document. But boy, when someone has a perspective shift in a positive way, at least as a clinician who works with other people, it can be so empowering, because just as maybe one way of framing this, instead of looking at everything bad that happens as, well, that's my shit life and there's nothing I can do about it, it can help you to reframe things in a more positive way. And even if that's all hocus pocus placebo, if you have a positive expectation associated with negative things, then that actually could lead to some degree of betterment, or at least, I would very loosely theorize that it could.
Yeah, I think that's happening in a lot of cases. And a lot of the work with psilocybin was done in cancer patients facing the end of their
Right.
life, facing severe illness. And that sense of you're at the end of your life, using that as a really fruitful time to have that deeper meaning and purpose and gratitude
Yeah.
for the opportunities that we have, because we live in a fabulous time for the most part. We have so much. And also the connection to nature. That's a thread that a lot of people come to of
Right.
after working with psychedelics, of wanting that connection to the natural world and listening more deeply to what it's trying to show us.
Yeah. Great point. Great point. You mentioned a few books. Are there a couple other books, or do you have a website or anywhere else you'd point someone who wanted to learn more about this?
Sure. I would definitely promote my website, Psychedelic Support. It has a directory of over 1,500 health providers that can help people with psychedelic integration. Many also offer ketamine therapy, and as other substances
Awesome.
are legal. We have free educational courses there, as well as continuing medical education courses for professionals that want to go deeper in their understanding of the science and the therapeutic approaches. And lots of free articles and other great resources there. As far as books go, you had already mentioned Stan Grof. That's a great place to start. He's written lots on these types of experiences and what they mean to the mind. I find all his work to be really fascinating. Maps.org has a bookstore where you can find lots of different psychedelic books on different topics. I think they do a great job of publishing stuff that's well written and topical for this conversation.
Right. Right. And maybe just really quick, I know this is a whole podcast probably in and of itself, but ketamine versus psilocybin versus MDMA, do you have any high level thoughts on, is one better for a certain presentation? Part of the reason why I'm so curious about this is ketamine obviously is somewhat widely available. And just wondering, as more and more people are studying these different compounds, is there a certain presentation type that might do better with psilocybin versus ketamine or whatever else? I know it's a broad question, but any thoughts there?
Yeah, I mean, I would say the research hasn't done these comparisons and trials. However, psilocybin has more data supporting its evidence for treatment-resistant depression. Ketamine as well. Depression, it can interrupt suicidality very quickly. Thing with ketamine, it seems to be more short-lived, the effects, anywhere from 3 days to 2 weeks, unless you're combining it with psychotherapy. That seems to extend the effects for longer outcomes. And keep in mind, all of these substances have really different pharmacologies and how they bind to different receptors in the brain, the experiences people have. But there are these underlying similarities with neuroplasticity. MDMA seems to be really good as a catalyst for psychotherapy. People talk a lot during that experience. There are periods of going within with eye shades and listening to music, but there is a lot of let's talk about what happened, or let's talk about how you're feeling. Psilocybin can maybe sometimes just take people out of their body into other realms of experience in ways that MDMA is more of a centralized presence of yourself. And sometimes psilocybin can feel just more more visionary, I guess is the word.
Right.
So how this will work for each individual, I think, could be quite different. It might relate to the neurochemical or receptor composition of each individual's brains. These experiences can be different from one person to the next. And then when we're talking about chronic illness, there could be new things that we discover that really point towards, hey, you have chronic pain and then this is probably the best treatment. And what we see with more non-medical settings is often people that have these experiences do want to try other experiences and compare for themselves about how that worked for them or what they got out of it. And it's often different.
Yeah, that's a really interesting thought, to maybe find a psilocybin clinic, a ketamine clinic, toe dip therapeutically into each one to assess what might feel best to you. But also, as I've been speaking with people regarding anecdotes, there does seem to be confirmation with what you're saying, at least as I've surveyed some of these people, that ketamine is a bit more short-lived, where psilocybin might be a little bit more of a longer lasting impact. And then I offset that by ketamine seems to have less of a dicey nature to it, where psilocybin can get a little bit more dark or anxiolytic. Not in all cases, but it seems that psilocybin's more fickle, and ketamine, I guess, being much more dissociative, is less likely to have that sort of impact.
Yeah, and ketamine has a wide dose range. So depending on what dose you're taking, it can feel quite different. And often with ketamine, it has an amnesic effect. And, when you get to a certain dose with ketamine, its original purpose was as an anesthetic agent.
Right.
But the, kind of like, what did I see in the visions or what did I experience can be sort of hard to grasp, like a dream, like you have pieces of it, maybe you feel different.
Right.
But like, what was the meaning behind that is, I think, harder to get a handle on than with psilocybin or ayahuasca. People have, or MDMA, people have a really good memory about often. I mean, it can be different for what unfolded during the journey.
Sure. That makes sense. Allison, love the work that you're doing. Really exciting field, obviously, tons to learn. Thank you so much for taking the time and sharing your thoughts with us.
Yeah, thanks so much. Thanks for having me.